Hey everybody, you're watching A Physio Named Jonah. That's this guy. Where in today's video, it's a bit different. We're going to be talking about a common healthcare expression. I'm bringing it up or even making this video in the first place because I think the expression needs just that bit of a change. So today we'll talk about what the expression is and then what I think the change should be. The expression is when you hear hoofbeats. Is it hoof or hoof? Actually, his headphones on. The expression is when you hear hoofbeats, think. I'm saying hoof weird. The expression is when you hear hoofbeats, think horses and not zebras. I'm gonna keep making myself laugh by saying hoof. The expression is usually used when you're diagnosing patients or figuring out what's wrong with somebody. It basically means that you want to think about the more common diagnoses as opposed to something that's really niche. Here where I live in Canada or North America in general, if you were to hear hoofbeats, there's basically a 0% chance it's a zebra, and it's way more likely to be a horse. So instead of picking some very niche diagnosis that maybe you learned about once in school, you're probably better off to think about the more common, more realistic diagnosis. A couple things right off the top. Likelihood that I hear hoofbeats whatsoever, based on the way that I live my life, pretty low. Also, there are places in the world where you would be more likely to hear a zebra as opposed to a horse, so if you live in a place like that, that's pretty cool. So now to the reason I made this video in the first place and the change that I think we should make. I think this expression should go, when you hear hoofbeats, get out of the damn way. Am I being a total smart aleck here? Yeah, it's kind of my thing sometimes. But there is an actual reason that I think this change should be made. As a physiotherapist, I work with people who are in pain or having difficulty moving in that specific moment, like right now when they're in the clinic with you. Sometimes it's important to address that specific moment and worry about specific diagnoses later on. Did someone say examples? Probably not, but if you could right now, that would make me feel better. Back pain. Good old back pain. It sucks, like a lot. As a physiotherapist working in an outpatient clinic, I get people coming into the office that often are in back pain that's so bad they can't stand up, sitting down might be uncomfortable, maybe there's no really comfortable position at all they can find. Sometimes in a moment like this or in an assessment like this, I might just need to find a comfortable position for that patient to start off with. Maybe there are specific movements that feel better for them, we can do some of those, think about that as a treatment. Maybe there are treatment techniques I can use in that comfortable position. The idea here is that I may not know the exact structure that's bothering them because I wasn't able to do all of my testing, but it's more important to address the elephant in the room that is their pain and then worry about the specific diagnoses as we go along and things become less uncomfortable. Did you get that? The elephants thing? Because the elephants are an animal and the horses and zebras, that's an animal expression, and elephants, animals. So like the elephant reference was referencing or alluding to the other animal reference, because they're both animals. This is writing 101, people. Coming back to the expression, even though I don't know the specific diagnosis, whether it's horses or zebras, I'm addressing the most important thing in the moment, which is the pain, or getting out of the way. After a large knee injury, it can be difficult to tell what's going on structurally inside of someone's knee. Hands-on testing can really only go so far, so we often rely on diagnostic imaging like MRI or other techniques to help us diagnose specifically what happened inside of someone's knee. Here's the problem. In Ontario, which is in Canada, where I live and work, waiting for an MRI can take a long time. And usually people who have had a knee injury are having difficulty bending the knee, straightening the knee, maybe getting upstairs, walking around. There are things that are bothering them right now, and we have to wait a fairly long time before we can get that MRI result back. If we wait for the exact diagnosis from the MRI to come back, someone's going to be stuck in limbo waiting to figure out whether or not these horses have stripes or not. It can be important to just get out of the way, help get that knee bending, help get it straightening, help with stairs, help with walking, the things that are important right now because life has to go on while we're waiting for a diagnosis. Again, it's not that you don't want to know whether it's a horse or a zebra that's going to be running you over, but sometimes it matters more to just get out of the way so that you don't get run over. hopefully these examples make it clear what I'm trying to get at here. If you're out in the wilderness or somewhere where hearing hoofbeats is a possibility and you hear those hoofbeats, the first thing that comes into your mind shouldn't be, "Oh, I bet I know what those are." It should be getting out of the way. Yes, we want to know the exact diagnosis or structure. Of course we do. In Western medicine, that's something we're always looking for. But there are times when it's more difficult to get that specific diagnosis right away, so it's important to not just stay in limbo waiting for that, address the moment that we're in right now and whatever needs the patient has in that specific moment. So, food for thought with a fun little healthcare expression. When you hear hoofbeats, get out of the way, and then make sure that it's horses and not, in fact, zebras. If you made it to this point in the video, thank you guys very much for watching. I really appreciate the support. Hopefully you were educated and entertained, or some combination of those two, and I'm going to be doing my best to keep releasing videos that try and do both of those things while I hopefully talk about something that you're interested in. What do you think of my new expression? Do you agree? Do you disagree? Do you think I'm crazy? Either way, let me know in the comments section. I'm pretty interested to see what people have to say about this one. Consider subscribing to my channel if you would like updates on future releases. Doing this also helps YouTube know that you are enjoying the videos I'm creating, which helps those videos get suggested more to other viewers who may also be interested. Most importantly though guys, as always, move your body, have a laugh today, and I will see you at the next video.